Welcome back. With us right now is Dr. Jeff Jacobs. He is, of course, with Harvard Eye Associates. Always good to have you on, Jeff.
Good morning, Ken. Nice to see you.
Doctor, today we are going to talk about non-surgical procedures to kind of get that rejuvenated look. Obviously, when it comes to Harvard Eye, while you deal with the whole face as well, but we have talked about in the past eyelid surgery, and it kind of explained in general around the eyes what kind of happens, especially as we age, right?
Right, yeah, so we've been here before. We've spoken about eyelid surgery. So there's surgical and non-surgical intervention, and then there's functional and there's aesthetic. So functional meaning that you're restoring somebody's function. So, you know, like we've talked about in the past, someone comes in and their eyelids are droopy and they can't see well, we can do surgery to help them see better. So that's the functional aspect of it. So what I'm talking about today is more aesthetic, where somebody doesn't like the way they look, or they have wrinkles, and not doing surgery for that. So, where somebody could just come into the office and have a procedure done in 10 minutes or 20 minutes or so, and then go home improved. So the main things that we offer are, one is Botox. Botox is something that you would inject painlessly into muscles, and the Botox helps to relax wrinkles. So if somebody, for example, has forehead wrinkles over here, or these lines over here are called 11s, and then these lines over here are called crow's feet. Those are the common areas, you know, where somebody would look tired when they're not tired, or they would look a little upset when they're not upset. And Botox is a quick treatment, takes a few minutes, and it lasts around 3 months or so, 3 or 4 months. And you know, somebody would come back on a regular basis, but it's an easy way to rejuvenate somebody's appearance in a fast way where that didn't involve much. Okay,
when it comes to Botox, obviously we've heard about this before. It's been around how long now?
It's been around about 30 years or so.
As far as using it for around the eyes and all, people are going to ask, well, are there side effects? Can people have an allergic reaction to it? I mean, you can have allergic reaction to anything,
You can have it to anything, yeah.
So what are the steps that you folks take?
So we do an examination, and we have a nurse anesthetist who's terrific. Her name is Marianne O'Connell, and one day we'll get her on here. But I work with her every day, and we're always evaluating patients, and she evaluates and examines patients, and then if she sees anything that's concerning, then she comes in and gets me or Dr. Diana Kirsten.
Yep, we know Diana well.
And we make sure that the person is a good candidate for it. So yeah, as far as complications, you know, if too much of it is put in, or it's put in the wrong area, it can weaken muscles and cause problems, but we make sure that does not happen.
Is that how Botox work? It
Botox
weakens, or
what it does?
I always thought just the opposite. It tightens things up.
Yeah, and it's interesting because people think it's almost like an anti-gravity thing, but it's more where what it does is it interferes with how the nerve communicates with the muscle. So it temporarily blocks that. You know, and it lasts, like we said, around 3 months or so.
So is there any non-surgical options that would last longer than that?
There are. So Botox is that affects the muscles. There are other things called fillers. So if somebody with time, you kind of, one of the things that happens is you lose fat and you lose volume in the face. And the face kind of, where it was here when you were younger, it kind of does that. So traditionally, you know, more than 15 years ago, people used to have a facelift or something like that, which is surgical. So that would be a surgical intervention. Now they do something more called a liquid facelift, because the fillers, they're liquids, and they're actually injected painlessly as well into the deeper tissues, you know, because you don't want it superficial, because then you can see the contour of it. So there are different types of fillers, and they're injected at different depths in the tissue, and they last different lengths of time. So that's something where somebody can come in, and then as soon as they walk out of the office, they see the effect of it. And that typically lasts around a year or so. Yeah, there are other ones that would last longer, but we do things that are predictable. You know, the other ones are, you're not sure exactly what you're going to get, and we like to do things where we know what we're going to get.
Yeah, I would agree with you. So what are these fillers, basically? Are they fat?
They're made out of something called hyaluronic acid.
Okay.
And if anyone's ever had a knee arthritis or a hip arthritis, where they inject materials into the knee, I don't know if you've heard about that, where people get stuff like a viscous material.
Yeah.
It's exactly that.
Okay.
So it's a substance that occurs in nature. It's called hyaluronic acid.
Okay.
And it's actually made by bacteria and then purified, so it's not human derived. So there's no chance of getting, an infection from somebody else.
Okay.
Like a prion or something.
Right. So this is another way to get rid of the wrinkles and all.
Exactly.
That's non-surgical.
Exactly. So a lot, most commonly with that, people would come in. They would have lip lines that they don't like, or the corners of the mouth would sag down a little, or even these are called nasolabial folds over here. So the treatment for that is actually not to do anything in there, but rather to reinflate the cheek over here, and it fills it up and it unfolds it a little bit. And you want everything to be subtle and natural looking.
Right, because we've seen it when it hasn't been on certain celebrities. Let's just put it that way.
Yeah. And we want people looking appropriate for their age and who they are.
Right.
But just the little better version of themselves. We're not looking to make people look significantly different, because it has a chance of not looking good.
Now, between the two, just those two you told me about, the Botox and the fillers, what is who would make that decision as far as, would it be the patient saying, you know what, I want something a little bit longer? Because I would think
they're different, and they complement each other.
Okay.
So you would do, more for like a forehead. You wouldn't in general put fillers in a forehead, although some people who have hollowness over here, this is the temple area, you actually can put fillers in.
Okay.
If someone's lost a lot of weight, you can
that's a good point.
You can reinflate that. So they complement each other. And then the third thing are lasers. So, and we do lasers.
Okay.
And that's more for the skin texture. So if somebody has fine wrinkles in their skin or discoloration, there's different types of lasers that target different areas of the
does
skin.
it kind of like, I don't know what it, stretch it out, or what it kind of
it would
burns them
more,
off? I don't know. Explain that.
It would more tighten the skin for some areas.
Okay.
Basically, the skin, the top layer is called the epidermis, and then beneath that is called the dermis.
Okay.
So sun damage from years of going in the sun would damage the epidermis, the top layer, and the top layer of the dermis. So the epidermis is the top, and then the top layer of the lower layer, which is the dermis, that would be removed with the laser, and then you grow a new layer of smoother skin.
So does that mean that when that laser is done, is it something where maybe for a day or two there's healing involved?
Yes.
Okay.
And it depends on the level of treatment and what type of laser. But in general, people are going to be a little reddish probably.
Okay.
For maybe a week or so.
Okay.
But
and does that last longer? For what you're
laser,
doing?
Yeah, it would.
Yeah.
Sure. And then, of course, afterwards, everybody has to wear sunblock, because you don't want to repeat the things that caused the damage in the first place that made you go get the laser in the first place.
Yeah, that's true. And of course, a lot of folks here, and myself included, we grew up at a time when you didn't hear of sunblock.
Right.
You had sun tanning lotion. You went out to get tan.
Or baby oil, with the reflectors.
Yeah, exactly. And now you're kind of paying the price years later. Isn't it true that as we get older, what's the top layer again?
The epidermis.
The epidermis gets thinner?
It does. And so does the bottom layer.
Okay.
So, what happens is everything, the word we call is attenuates.
Right.
Things just kind of thin out.
Yeah.
So the top layer of the skin thins out, the middle, the bottom, and the fat underneath it.
Okay.
So the fillers serve to re-inflate the lower layers, and then the laser resurfacing serves to resurface the top layers so it's smoother. And then for the wrinkles that are under the skin, the Botox works. So you could use all of these modalities.
Yeah.
For one person, but we of course find out what's bothering that individual person, and then tell them what can be done, and then work out something that's safe for them.
Right, and of course, as you said, these are what they used to call cosmetic or non-functional. when there's
Exactly.
a real problem, as you've talked about in the past, your eyelids are drooping down, it's limiting your vision, there's a real problem. That's a whole different thing.
That's completely different.
Yeah, which I know you've talked about
Which would
before.
improve somebody's actual vision.
Yeah.
So, or reading, or when they're driving a car, something like that.
Yeah, exactly. Well, I want to thank you for coming on.
Yeah, well, thank you.
I know you have a clinic to get to and all.
Yeah.
And I really appreciate, always good to have you folks on from Harvard Eye.
Always a pleasure. Thank you
so
much.
And we had a nice chat beforehand. So if you ever want to talk about seeing all the stuff back east and all that kind of stuff in Virginia and up to DC and New York, he can tell you all about that.
Terrific.
Good to see you. We'll see you next time.
Take
care. We'll be right back.